Everyone, thanks for joining. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we're here just to give a COVID-19 update for Chicago. Oh, thank you. So first, to start off with an update on the travel order, we have good news. We are removing Nebraska and Wisconsin from Chicago's travel order. We are, on the bad news side, adding back Iowa and Kansas. At this point, Chicago's emergency travel order now covers 19 states and Puerto Rico. I'll remind you that states are added to this list if they are seeing more than 15 cases per 100,000 population per day. It is purely based on data. We have two states, Arizona and North Carolina, that are in their first week of being below that cutoff. So if they are able to maintain that progress next week, Arizona and North Carolina could potentially come off the list. Wisconsin is obviously of most interest to our Chicago residents here. They've had 2 weeks of being consistently below that cutoff, and at this point they are removed from the list. As a reminder, we update this travel order every Tuesday, and then it goes into effect the following Friday at 12:01 a.m. Travelers entering or returning to Chicago from any states covered by the order must quarantine for a 14-day period from the time of last contact within the identified state. Essential workers are exempt if they are traveling for work, but they need to limit their activities to work-related activities, avoid public spaces as much as possible. We have a lot of frequently asked questions about this order on our website, chicago.gov/coronavirus. I want to also give an update on what our numbers are looking like here in Chicago. You can see here the overall graph showing our individual cases per day, and the black line showing our average. You can see that at our peak in early May, we were seeing more than 1,000 new cases per day on average. We currently are seeing just over 300 new cases per day on average. We're at 307 new cases per day. That's really been fairly consistent over the last week or two. We've seen that flatten, but we've not yet seen the decline that we'd like to see. As a reminder, our first goal is to get that number back under 200 new cases per day. We were there in June, and if we can get back under 200 new cases per day, that would take us out of a high incidence state and let us again be starting to move forward thinking about reopening instead of needing to think about taking additional precautions. I'll also remind you that 400 number is really our major concern that we don't want to get to. If we get to a point where we're having 400 new cases per day, that's the level at which we're requiring people to quarantine returning from other states, and that would be the point where we might be needing to think about pulling back even further. Similarly, our testing numbers remain very good. You may have seen nationally that there's been some fall off in testing. We have not seen that here in Chicago. We've continued to have consistently high testing, well above the 4,500 tests per day that we've set as our minimum. In fact, we're averaging often above 7,500 tests per day and continuing to see good progress there. Our test positivity rate is at 5%. Again, we would like that below 5% ideally, but we've not seen it spike up like we've seen in some other parts of the state and some other parts of the country. So we continue to be in a little bit of a holding pattern there. Continue to encourage anybody who has symptoms potentially consistent with COVID to get tested and to stay home while you are awaiting those test results. Similarly, our hospitalization data and our death data is stable. We have not seen any increase in hospitalizations, in ICU hospitalizations, in patients on ventilators. That's good news. It means that while we've been able to tolerate some of these increased cases, particularly among younger people, we've not seen a lot of spread at this point to people who are older, people who have underlying conditions, who would be at high risk for hospitalization. So at our peak, we were admitting on average 175, 180 Chicago residents to the hospital every day. We're now down at a point, often it's fewer than 20 residents per day getting admitted. Deaths, similarly, have come down nicely and stayed down. At our peak, we were unfortunately seeing almost 50 Chicago residents per day dying from COVID. We have been stable at about 3 deaths per day over the last couple of weeks. Actually, today we're down to 2 deaths per day on average. I expect that to continue to fluctuate, but it's good. We've not at this point seen a major effect of the slight increase in cases on either our healthcare system or on those severe outcomes. Similarly, here's what's happening with our daily case rate by age group. Those of you who have been following along with Chicago data, you can do it on chi.gov/COVID-. You'll see that we continue to see our highest case rates in young adults. Our 18 to 29-year-olds, that's that red line on that graph there, are still the group where we are seeing the most new cases. Early on in this outbreak, when we were really seeing those very bad numbers, we were seeing a lot of cases and the highest numbers in older Chicagoans, people over 70 and even over 80. The fact that we've now flipped that is good news, again, in terms of those severe outcomes and protecting most vulnerable Chicagoans. You can see that that red line has flattened a little bit. We continue to have a major focus on outreach in that 18 to 29-year-old group. We continue to keep a close eye on it. Similarly, highlighting our daily case rate by race ethnicity. So this is a graph going all the way back to the beginning of our outbreak here. That purple line highlights Black non-Latinx cases. You see initially back in March, that was our earliest surge. But then in May, we really saw the biggest surge among Latinx Chicagoans in terms of cases. And you can see that blue line has really continued to disproportionately be represented in COVID cases in Chicago. And so more recently, you can see that we have put and will continue to put a focus on Latinx Chicagoans and neighborhoods that have heavily Latinx members within them, because we are disproportionately seeing spread of cases there. I want to highlight what that looks like geographically in Chicago. This is a hotspot analysis highlighting between late July and early August where we are disproportionately seeing cases. Parts of Chicago that are blue on this map, we are seeing less cases than you would expect if cases were uniformly distributed. In red are where we're seeing more cases. You can see that we continue to see extra cases in the Northwest, in the Southwest, and then a little bit on the Southeast, although we've actually been making some good progress in those neighborhoods. Importantly, only 5 to 6% of our new cases at this point are associated with big outbreaks, a place-based outbreak, a congregate setting, a big workplace, a jail, a long-term care facility. More, we are seeing spread within households and within small gatherings. If we look at a little bit more data using that same hotspot analysis, this is comparing in red the parts of the city where we're seeing a lot of cases, the far south, the southwest, the northwest, compared to the other areas of the city. We see that in areas where we're not in as good control of COVID, we're not seeing a lot of people traveling outside Illinois. Only 6 to 10% of the cases in those hotspot areas are reporting travel outside Illinois, as compared to about 17% of the cases in the rest of the city. We're also not seeing a lot of spread from people attending events and gatherings. Among cases really across the whole city, it's 7 to 10% of cases after attending some sort of large event. We've asked about things like protests. We've asked about things like larger religious gatherings, other reasons why large numbers may come together. That's not broadly what people are reporting as risk factors for spread. Instead, what we see, particularly in Northwest and Southwest Chicago, which are heavily Latinx communities, we're seeing a lot of spread among family members. You'll see that in our cases overall in Chicago, about 58% have a contact with a family member. In our hardest hit areas, that goes up as high as 81% of the cases. And a lot of those are within households. We also know that in some of the hardest hit areas, we have more people living in detached single-family homes. We know there's more multi-generational families and potentially more exposure to people of different ages. Where we also look at the underlying risk factors, those hotspot census tracts just have more people, an average population of 4,400 as compared to about 2,700 in the cold spot census tracts. Density does matter where we're thinking about COVID risk. The hotspot census tracts also have more cases or more individuals that have dependents, have young children or elders that they're caring for, 38% as compared to 29% in the cold spot census tracts, and about 5.5% of people in the hotspot areas living in crowded housing as compared to 2.5% in cold spot areas, pointing to just underlying root causes where we think about some of the different ways in which COVID presents. Finally, I just want to highlight some of the recent work that's been happening around outreach and education, particularly with a focus on youth. So the City of Chicago works with partners across the city to have summer jobs available to 20,000 Chicago youth every summer through One Summer Chicago. These are youth between ages 14 and 24, high school students, college students, other young people in Chicago. And for the first time this year, we had a Chicago Youth Service Corps, and a few thousand of these folks were focused specifically on COVID activities. These were some of the social distancing ambassadors, the young people who were out through Chicago Park District in our parks, along the lakefront, in neighborhoods, really encouraging people to wear masks, respectfully asking people to socially distance, and encouraging people to do the things that we know help protect all of us from COVID spread. Very successful as a program. I think very good uptake and good adherence to mask wearing with an educational approach there, particularly from young people, I think. We've also, as you know, done some focus around the We Are All One Home team. This is all of the professional sports teams in Chicago really coming together. We've had a youth focus here too, and the 18 to 29-year-olds have had street teams going out, really distributing masks, distributing good information, a lot of youth-focused work, and I really want to thank the many, many, many hundreds and hundreds of young people in Chicago who have partnered with CDPH to bring the message about masking, to bring the message about the risks for younger people, particularly around spread. These are just some of the street teams and some of the work that's been going on. And then finally, I just want to remind you that as you are thinking about your own COVID-19 risk here in Chicago, if you live in one of those areas that is blue, that is less of a risk, it does not mean that COVID is gone. We continue to see people diagnosed with COVID in every zip code in Chicago. We continue to see people who get very sick with COVID. We see people admitted to the hospital, and we're still seeing on average 2 to 3 people dying every day just among Chicago residents. So I don't want people to let their guard down, no matter what part of the city that you live in. I do want everyone to be thinking twice. First, think about not just yourself, but all of the people in your bubble. Who do you have close contact with? Who is in your household? Who do you see without making sure you're both wearing masks? You're both keeping that social distancing. Those people are in your bubble. And if any of them are over 60 or have underlying conditions, you need to be more cautious about the risks you're taking. And then step 2, you're going to think about the activity. And so in addition to thinking about yourself and the people you have contact, you want to think about, can you avoid crowds? Can you avoid interactions with people you don't know? Can you keep that 6-foot distance? Can you always wear a mask? And is the activity outdoors? If the answer to all of these things is yes, that's a pretty low risk activity. But as you start thinking about higher risk activities, particularly if there are folks who are at higher risk within your bubble, I ask everyone in Chicago to do the things that we know work. Wear those face coverings, keep your physical distance, do the good hand hygiene, and protect those among us who are most vulnerable. If we do that, I'm confident we will continue to keep this outbreak broadly in control. We are in summer now. Now is the time to get this in control. As we start to move into cooler weather, there will be less opportunity for us to dine outdoors. There will be less opportunity for us to socially distance and exercise out of doors. There will be less opportunity for us to potentially spread out and do some of the other things that have helped keep our risk low. So now, August, September, is the time to double down on the things that we know work. With that, I am happy to take questions.
Thank you, Dr. Arwady. As I hear you speak about that the large gatherings haven't turned out to be sort of the source of trouble, might the city allow restaurants to have more than 6 at a table, or those who are planning a reunion, an event, a wedding, perhaps have more people at those events?
Yeah, so when we think about the number of people who are gathering at an event, particularly if they are gathering in a setting like a restaurant where you can't wear a mask, at least during the time that you're eating and drinking, we really think about what is the risk that someone will have COVID in a group of a given size. And even when we were at 200 cases per day on average, there was still, given the number of active cases that means we have here in Chicago, about a 15% chance that in a group of 50 people, for example, you would have someone with active COVID who may not know that. So as we have seen that case number go up instead of go down, that's part of why we've brought some of those restrictions back down. Brought from 10 down to 6 is literally about the risk, again, of having people who may be without a mask in a gathering size. We will not be thinking about loosening those restrictions until we get back down under 200 cases. We get under 200 cases, we move out of a high incidence state, we can then start thinking again about, are there safe ways to further reopen? But while we're in this 200 to 400 zone, we're kind of in a holding pattern. And if we start to see concerns among any given group, like we did among younger Chicagoans, like a little bit we are right now around Latinx, we will continue to focus resources, education, testing, case investigation. But I want to be able to move ahead as much as everybody else does, but until we see some progress there, we will not be looking to further expand.
From Brett Chase at the Sun-Times, can you explain the large number of COVID cases that continue to be reported on the city's west side? Are infections being initiated at job sites? And is the virus largely being spread indoors or outdoors or both?
Yep. So we, as you know, do case investigation and contact tracing for every case of COVID that is diagnosed in the city of Chicago. We reach out to more than 90% of the cases that we receive within 24 hours. We do not always successfully complete a full investigation, and we continue to work on increasing our data there. That's where some of our contact tracing work in the communities is in place. But broadly, we have good data about what the risks are, and very different from early in our COVID outbreak. We just are not seeing, by and large outbreaks, including in workplaces. There certainly are individual settings that we follow, and any time that we have concern about spread in a workplace, the Chicago Department of Public Health gets involved. We go, we see what kind of testing may need to happen. Do we need to shut places down? Are there things that need to be in place to help mitigate risk? But broadly speaking, although we follow small clusters, most of these may be 2 to 3 cases. It is rare at this point for us to have the significant spread in workplaces like we were seeing earlier. And instead, like I mentioned, primarily we're seeing this among people at home and among family members. I've had the pediatrics investigation team really focused a lot on kids over these last few weeks, especially, in the context of thinking about schools and childcare. And we just continue to have examples of young children who live in households with multi-generations. I remember the case investigators telling me this week about a very young child who tested positive, whose mom is an essential worker, but is needing to stay home because she's she's the caretaker. The grandma's been admitted to the hospital. The great-grandmother and the great-grandfather have been admitted to the hospital. You see a lot of spread, unfortunately, and especially those people at most risk. It can really be a difficult situation. So we've been working to try to get resources and support for families that are in these difficult situations and continue to really push testing. But different from what we were seeing earlier, this is not primarily driven by workplaces. It's driven by settings where people feel safe. They let down their guard among family and extended family.
And this might apply to this question as well, but from Jim Williams at CBS 2, if you look on the southwest side at zip code 60629, the positivity rate there is above 14%. How do you explain that, and what messages do you have for the folks who live in that zip code?
Yeah, so I do want to make a little bit of a distinction between the test positivity and the person positivity. I know this gets into the statistics and it's a little confusing, but I do think it's important. The test positivity, that 5% rate, that's where we take our number of positive tests and we divide it by the total number of tests that are done. That is how the Illinois Department of Public Health reports out on positivity and tests, and so we felt that it was important to report that because those are the numbers that we look at across the state. Where we are looking at any geographic-based or race ethnicity-based or age-based testing, we use person-based positivity, and that means we take the positive tests and divide it by the number of individuals tested. So if someone has had multiple tests, say they work in a nursing home and they're getting tested very frequently, they count once. Say somebody had an exposure and they're concerned and they get tested multiple times, they count once. So the person positivity would be what we would use there. And our person positivity is over 6% as a city. Where we are seeing 14%, which is our highest this week, our highest quintile is in the 10 to 14%. That is where we are just seeing a lot of community spread. It continues to be driven, like in the data that I showed, a lot of this by household spread, first and foremost. Secondly, by a lot of these smaller social gatherings. We push our pop-up testing specifically to zip codes with the Race Equity Rapid Response Team, where we are seeing surges of cases or positivity. We also push education. We are doing additional outreach and additional work, particularly I think with Latinx leadership across the city. If people have good ideas about how we could do a better job beyond just language, which obviously we're working on, but I really want to make sure that messaging is reaching the folks who live in these zip codes so that they know that right now they're at increased risk. We've seen on the southeast side some very nice progress there. We were seeing the highest positivity rates in the city there a few weeks ago, and we've managed to make real progress there. My hope is we will continue to see that same progress on the northwest and the southwest sides. But it's not a mystery what's going on there. There's just a lot of spread right now in the community.
From Kelly Bauer at Block Club, what is your plan to prepare for the flu season in tandem with the pandemic this fall and winter?
Yeah, I love this question. So as you know, I have an emergency preparedness team at the Chicago Department of Public Health whose job at all points has been to think about not what we do tomorrow, but what we do in 3 months, 6 months, 1 year. And so this was the team that at the beginning had done a lot of planning even before the pandemic had begun. And right now they are fully focused on our immunization planning. And we are using our flu vaccine campaigns to practice, prepare, and test some of what we're thinking about for COVID vaccines. So, for example, historically, the Chicago Department of Public Health would say, come one, come all to flu clinics, open up at aldermen's offices, open up in our van, et cetera. We are moving instead to more controlled settings so we can have social distancing. We're having people register in advance. We're trying to use some of our paperless technology. Ideally, by the time we get to COVID, we will not use paper at all. I want to make sure there's a good registry, and we're working on the tech behind this. But it is really important. Flu shots are just becoming available, and we need people to get a flu shot. The last thing we want to see this fall and winter is any amount of COVID, even the amount we have now, on top of our predictable pandemic, which is our flu season every year. Our hospitals get full every winter, largely because of flu. In the southern hemisphere, we've seen some pretty good news so far that the flu season has not been as bad as it often has in prior years because people have been being careful with COVID. All of the things that you do in terms of keeping your distance, washing your hands, wearing your masks will probably help protect against other respiratory diseases like influenza. But the vaccine is so important, especially for younger people and older people. Different than COVID, flu hits young people very hard. We have young people hospitalized every year from flu. We have deaths every year in Chicago from young people from influenza. We have a vaccine and we need people to get it. So please reach to your provider. They are starting to get flu vaccine in place, and now is a good time to go to your doctor if you've not been, to get caught up on your preventive health works and to get your vaccines. If you've got kids and they've missed any vaccines, pediatricians all around the city are working hard to do catch-up vaccines. It is getting toward back to school time, even if not all of our children are going in person. And you can get flu shots through pharmacies, and you can also go to the Chicago Department of Public Health website if you want to see where we have free flu shots available. We will be reporting out on our influenza progress and how we're using that to plan ahead for COVID.
And while CPS is going full virtual, some private schools plan to hold in-person classes. They've already started. What are the plans? Has the city discussed enforcement measures if these schools face outbreaks?
Yeah, absolutely. So we have been spending just hours and hours and hours and hours working with all of our educational institutions around the city at all levels. That's from the youngest preschool up through the grade school and high school to our institutes of higher education that are also making difficult decisions right now. And the role of the health department always is to respond to cases where we see them. We work to help schools or any other setting have the appropriate precautions in place to mitigate that risk. So you heard a lot about what we were planning with Chicago Public Schools. If we get to a point in the second quarter where we're in better shape, like we have a lot of practice in terms of really limiting that risk. And we've learned a lot from having camps open, from having daycares open, childcare. Like I said, I've got this pediatric team that looks a lot at any pediatric cases that come in, so we understand risk factors there. If and when there are cases in school settings, we will respond. We will work with that school. The reason that there are pods and other ways of keeping students separate is that you're able to avoid the widespread COVID that you would see, and we would do all of the same follow-up that we would do in any other setting. So I feel good about the planning that's been done there, and we will continue to work with all of those schools as we do other partners.
Block Club also asking, do you think there will be a need for a national shutdown in order to truly get the virus under control?
Yeah, it's an interesting question. I continue to think that local responses are probably the most important thing here. We know that there are parts of this country, rural Maine, that have virtually no COVID right now. We know that there are parts of this country, like Mississippi, that have COVID outbreaks that are just in terrible control. And I actually think that it is appropriate to make those mitigation decisions based on what a local outbreak looks like. Because if you're in a setting where there is very little risk for COVID transmission, I would not want to limit children's ability to go to school. I would not want to, limit the ability for businesses to function, et cetera. We may continue to see additional coalescence around travel within the U.S. It'll be interesting to see how this develops, particularly as we move into the fall and winter. As you know, it's been a little bit of a patchwork around what various quarantine orders look like. I think ours has been extraordinarily successful, actually, in terms of raising awareness of risk around travel. We've gotten a lot of questions, a lot of visits to our website. We've seen a lot of people, and thank you, delaying vacations and non-essential travel to places where the outbreak is in poor control. But I think it's possible we may see some more coordination around understanding what risk looks like at a regional level. But I think that, so much of this depends on what happens at the national political scene. My job here is to do everything that we can to protect Chicago, and we will continue to do that and make decisions based on what our local data looks like in conjunction with regional, state, and national.
And A.D. Quigg from Cranes is asking, Water Commissioner Randy Connor says the city should be rolling out plans to replace lead service lines in the city in the weeks to come. Can you tell us more about what that program might look like and who it would target from a public health perspective?
Yeah, so I don't have the details in terms of what exactly is happening with that program, but I can let you know that certainly the Chicago Department of Public Health works in the same way that all COVID cases are reported to us. All cases of children every child who gets a lead test, who is a Chicago resident, gets that result reported to the health department. And whenever a child has an elevated blood lead level, the health department works to first make sure that child is in appropriate clinical care, just like we would for COVID. And then we actually work, depending on the level, to figure out what was the exposure of that child. We have inspectors who go into homes or into other settings where children are. Obviously, we've had to have some alterations with that around COVID. But by and large, we do continue to see most children who have lead poisoning or high lead levels here in Chicago still as a result of lead-based paint. We have a lot of old housing stock in Chicago, and where paint is not always well maintained and it can flake or dust off, that still is where we see the bulk of testing. But we have a legacy problem of lead service lines, of these water lines, and that is not what drives most of the lead poisoning here. But I think it is appropriate for the city to be taking a really serious look about how do we start to tackle this legacy infrastructure issue. So I know that there have been discussions about how to make sure that that is rolled out in a way that recognizes people in different parts of the city have different access to resources. We've thought about equity within that. We've thought about data, certainly. Where do we see higher levels of children, in particular with lead poisoning? And then we've thought about logistics. So if the water department is already in working on things related to the water mains, that could be a good moment to start thinking about this. So I don't have more details with me right now, but certainly look forward to hearing more about that. And it remains, the health department has not stopped all the other work that we do, and lead poisoning prevention really remains, a focus for us. So I think it's exciting to hear about what this is going to look like.
I think it's just interesting that because we've all been so focused on this, you still have so many others.
Oh, yes.
Lead testing, and then children not in the classroom. How do you stay on top that those tests are still being taken?
Yeah, so most of the testing for lead for children, it happens through their pediatricians, and it happens at their well child checks, importantly, typically. And the health department's actually done a lot of work to make sure that people and pediatricians know that, and parents should know that your child should, if you live in the city of Chicago, period, your child should be getting a finger prick lead. That should be happening, at your 1-year-old well child check, for example, and then depending on what we see moving forward, in addition. And where we have seen young children not getting their typical physicals, we've seen some drop off in vaccines. We've also seen some drop off in lead testing. So again, a reminder, now is a good time where we are broadly in control to bring children, especially young children, who this is like the best work of public health, preventing disease, preventing further lead poisoning, preventing vaccine preventable diseases, all of the other things that pediatricians do, they're so important. Now is the time to get those well child checks done.
Those were the questions.
Yeah, I have a couple of questions.
Sure.
With the infection rates spiking downstate, especially the areas around the St. Louis area,
yes.
is there any chance that the quarantine order might be extended to parts of Illinois?
Yeah, it's a good question. So we've talked about that. At this point, there are counties within Illinois that we would quarantine against if we made decisions by county, but we don't. We make decisions by state, and we talked about this with Wisconsin, actually, because that was a difficult decision. Do we only limit our quarantine order maybe to the counties that are having more concern? We felt like, to be consistent with what's done across the country and to just help avoid confusion for everybody, that we would keep it at a statewide level. We continue to monitor closely the situation in Illinois, and at this point we are also seeing some flattening broadly across the state. I do not expect that we would try to put quarantine in place for counties within Illinois. Certainly if we were to see major issues, that's something we might evaluate. We will continue to educate about parts of the country and parts of the state where there is more concern. And so to your point, the Illinois Department of Public Health, has designated 14 counties right now as counties of concern. None of those, that's not Cook County, that's not the counties that touch Cook County, but we want people to be aware that even travel within Illinois, and particularly in Region 4 down by St. Louis, there is an outbreak that is not in particularly good control. So I don't expect a quarantine order unless we really were to get into an unusual situation. But anywhere that the outbreak is not in control in Illinois is a big concern to us.
My other question is, based on the infection rates, the charts you were showing today, why are the infection rates so stubborn in that age group between 18 and 29?
Yeah, so couple things. I think, first of all, if all of the infection rates are actually sort of stubborn per se, the way that they're going out there with the 18 to 29-year-olds, it's not just that the 18 to 29-year-olds are on top, it actually remarkably marches down by group. So 18 to 29-year-olds are on top, and then nearly every day, 30 to 39-year-olds are next, followed by 40 to 49, 50 to 59, 60 to 69. It really has layered out in such a way that I think that it is most reflective of whether people have underlying conditions and whether they are being particularly careful around the COVID guidance. And so we think about the fact that older people broadly are at higher risk for severe outcomes from COVID, are also more likely to have those underlying conditions that put them at severe risk for COVID. We also know that just that developmentally, younger people are perhaps more likely to take risks, less likely to have that. So it doesn't surprise me, actually, that that is the way that we are seeing our outbreak look in terms of age distribution. And if I had to make a wish for how it would look, that's how I would want it to look, because I would prefer, not that I want anybody to get COVID, but in terms of that risk for the healthcare system and that risk for the severe outcomes, I want those older people at the lower levels. If our 18 to 29-year-olds can continue to responsibly wear masks and protect against transmission to people who are vulnerable around them, I think we could continue along this way without seeing major negative impacts on hospitalization, et cetera. So it's less that it's stubborn for me in the 18 to 29-year-old group and more that it's just flat and distributed in a way that I might expect. Where I think about a group that I have more concern, I would actually say more recently in the Latinx community. Less about age for me and more just that we are seeing additional spread there. It's not unexpected where we know there are close community ties there. We know there are more multi-generational households. We know there are people who do essential work. We know there's more crowded housing. But you're going to be hearing some more from us in partnership with many leaders around Chicago as we really work to get that hopefully down even a little bit more. When I think about what's, quote, been stubborn, it's some of these predominantly Latinx neighborhoods. Even though so many people in those neighborhoods are doing good work and doing the right thing, I just think structurally we have some differences in the way people interact. And so particularly folks in those neighborhoods, especially important to protect people who are vulnerable, to not go and, if you're waiting for a test result because you have symptoms, you need to isolate while you are waiting for that test result. If you're told that you've been a close contact to somebody, you need to keep the full quarantine, even if you have a negative test result. We've been working on some of this messaging and just trying to think about how to limit risk even within households.
You have one more, Marianne?
No.
No? Okay, thanks, everybody.
Thank you.
Thank you.